Good evening, everyone. Welcome to the April 2022 meeting of the Community Board 2 Health, Environment, and Social Services Committee. My name is Brandon Smith. I'm the chair of the committee. I welcome you to tonight's meeting. We have a very jam-packed agenda. Got to read some meeting protocols first, though, so please pay quick attention to this. This meeting is being recorded for public access and archiving in accordance with the New York State Open Meetings Law. It is the practice of CB2 to conduct remote meetings with all committee members' cameras on. Public attendees are also encouraged to leave their cameras on if you are given the floor to speak. All attendees, please keep your microphone muted when you are not speaking. To make an appropriate discussion and voting process, I will make it known when and which topics are open for comment by committee members, board members at large, and the general public. If you have questions that fall outside of public comment time, please type your questions in the chat panel and we will address them as time permits. You may also email the district office at any time outside of these meetings. We are committed to providing access for all of our neighbors, regardless of physical ability or limitation. If you require accommodation for assistance for full participation, please contact the district office 72 hours before in any public meeting. We also ask those speaking or presenting use plain language, speak at a moderate tone, and frequently ask if you're speaking loud enough. If you are presenting, please read the title of each slide and describe any images on the slide, such as photos, graphs, or charts. I also have a further advisory for every meeting. At this committee and at every one of our meetings, it's important that we treat each other with respect. Anybody who is not being respectful to anyone else, regardless of whether you're a board member, a committee member, a staff member, a presenter, or a member of the public, I will reserve the right to ask the board office to remove you from the meeting. And I would really heavily encourage everyone to try to treat each other with respect. So with that in mind, I'm going to get started with tonight's meeting and we'll do some brief introductions. It looks like at this time we do not have a quorum just yet, but we'll just need to get one more person and then we'll be able to proceed with committee business. But let's get started with introductions, and the score immediately next to mine is Ms. Einhorn. Do you want to introduce yourself?
Sure, thank you. I'm Lindsay Einhorn. I'm a community member, a member of the committee on the board.
Excellent. Ms. McKnight, do you want to introduce yourself?
Good evening, everyone. I'm Nicole McKnight. I'm the vice chair of the committee and a member of the board.
Thank you. Ms. Anadu?
Hello, my name is Emily Anadu. I'm a member of the HESS committee and the community board.
Excellent. And Mr. Andrews?
Hi, guys. It's Victor, a member of HESS committee and I guess the board, I don't know.
You're most definitely a member of both. We're happy to have you, Mr. Andrews.
Thank you, sir.
We're also honored to have Ms. Carolyn Hubbard Weary from the board here, as well as Ms. Masso, who's also a board member tonight. I can't proceed in the normal. Oh, Ms. Muller, do you want to introduce yourself? I'm sorry, I forgot you.
Hi, Taya Miller. I've been communicating with all of the applicants tonight. Nice to see you in person, district office.
Thank you, Taya. Taya, we're very appreciative of your efforts. Let's go into our first presentation for the evening. I just need to pull up my agenda very quickly. I think that would be, and correct me if I'm wrong, it's Mr. Chaim Gross with a presentation on, or no, I'm not going to jump there just yet. I'm going to see if Ms. Anadu can give our COVID-19 update first, because we can do that. Is that okay with you, Ms. Anadu?
Yes, that is okay. And I'm starting a timer to stay well within bounds. Okay.
Thank you.
The timer. But now this is where it all falls apart. Okay. COVID updates. Okay. Share screen. Ignore all my tabs. Can everyone see my screen?
Yes.
Right. So this is the April 6th update. And for everyone, this will be available through the community drive later. So don't feel the need to take copious notes. Also, the March update is at the back of this presentation. So you can see that in case you missed that last month. So getting right into it, last month I started with this slide, which basically showed that we're almost getting out of the woods and we're seeing some light at the edge of the woods. But this month, I'm sad to say it looks like we are pitching tents in COVID land. And so why do I say that? So looking at NYC overall, we are trending in the wrong direction. So last 7-day average, and this was as of April 4th, our rates are increasing. And so just for reference, in March, the 7-day average at the committee meeting was 1.94. We see it's up to 2.89. So increasing cases, increasing positivity rates, hospitalizations and confirmed deaths are going down. So that's obviously a good thing, but overall rates are going up. While last month we only had a couple of pockets where our positivity rate in looking at different neighborhoods within CB2 was higher than the New York rate, we can see that other than Williamsburg South, key neighborhoods are actually significantly higher than the NYC rate of 2.89. So seeing parts like Brooklyn Heights, Dumbo, downtown Brooklyn at 5.63, just, some really troubling numbers there. As far as reference, as I highlighted at a high level in the previous slide, overall, like deaths and hospitalizations, luckily are not trending in the same kind of jumps. But again, this is alarming data. And I just think it's a reminder for all of us that COVID is definitely not gone and is still here. This slide, I'm continuing to be the bearer of not great news. Last month, when we looked at this, most of the districts were moderate, or most of the areas were moderate. There was one area that showed substantial transmission, but we see in every area, NYC, overall NYC, Brooklyn, overall Brooklyn, and then different pockets. And this data just is lining as much as I can with census data. But we see the transmission rates are getting really high. The idea of high is set by the CDC, and so it goes from low to moderate to substantial to high. So we are definitely in the highest category of transmission rates right now across the board. Vaccinations still matter. So to the earlier comment about hospitalizations and deaths are not, going up, luckily, in the same way that positivity rates are. And so here we're seeing, if we compare March at the top in April, that we are, while there are overall more cases happening, we're seeing less, we're seeing just, luckily the trends in terms of hospitalizations and deaths are not as bad, but vaccinations still matter. And it's a shame that vaccinations definitely matter, because as with last month, we also see that Brooklyn continues to be the least vaccinated borough. In March, we saw that the only kind of age group that Brooklyn was doing better in, or was not at the worst ranking, was in children ages 5 to 17, and only Staten Island has the distinction of being slightly less vaccinated than we are in that age group. Other troubling information. So a few troubling things actually when it came to vaccination rates. So one, just the column on the left where it's describing the positivity rates, that's the same information we looked at earlier. But we're still seeing neighborhoods within our district that are seeing much lower vaccination rates than overall NYC. But one of the most troubling things I saw when looking at this data, which again, you'll be able to view the whole presentation or March after, is that NYC, when we look at basically percent of residents with at least one dose and fully vaccinated, that across the board, that number ticked up less than 1%, not only for New York City overall, and definitely for different areas of within Community Board 2. And so for me, that's just showing that at the end of the day, people are like, basically no more people are getting vaccinated. People are really just like, what it is, what it is, despite the fact that rates are going up. And I believe that is the end of the presentation. And sorry, I just ran a little bit over 5 minutes. Apologies, Brandon.
Well, I would say that was amazing. It's just so sad to see that the numbers are going in that direction. And it's a reminder that as much as we want to just sort of get on the same page with, you know, we're all getting out of the woods, we're really not. And it's something that we're going to need to stay vigilant about and keep paying attention to. And I just want to say I greatly appreciate that you're bringing attention to it. And I don't want to cut you off. Was there anything else you wanted to add to it,
Just
Emily?
a couple quick things. One, just like continue to encourage people to get vaccinated. Like at the end of the day, there's always, I get people want to get back to life, but it's really sad to see that again, from March to April, a whole month has passed and no more people statistically have gotten vaccinated in the past month. The other thing, not suggesting causation, but correlation in terms of the if on a day-by-day rate of upticks happened with the mask mandates being removed from school. So again, I'm not suggesting causation. I don't have the data to prove that, but what I absolutely do have in the data is a correlation between the uptick and the removal of the mask mandate. So again, just stay vigilant, everyone. COVID, it's up to all of us, but encourage people to get vaccinated.
Okay. Questions from anyone on the committee for Emily on her presentation?
I would just mention that there's one more correlation, which is the new variant, which has gone from 25 to 84% since our last meeting in terms of the positive cases. So I think there's a couple, it's hard to draw correlations, but I appreciate that we all want to wear masks again.
It's hard to draw causation. Correlations or
Causation, thank you.
Right. Hearing nothing else, I wanted to give Ms. Cobb an opportunity to introduce herself as she joined us and has now brought us to quorum. Ms. Cobb?
Yes, my name is Akoso Cobb and I'm a member of the board. Thank you.
Thank you. We're so happy to have you and it's nice to see you again this month.
Thank you.
I want to transition to our presentation for the evening, but first I'd like to ask if anyone would like to make a motion to approve tonight's agenda with the caveat that we did the COVID-19 update first in sort of out of order. Motion from Ms. Einhorn. I second. I'll give it to you, Victor. You second the motion.
Yep.
Does anybody not approve the motion to approve the agenda with that condition? Or abstain? Say so now. All right, we've got a unanimously approved agenda for tonight's meeting. With that, we can go into our first presentation, for which we are very grateful to have, oh, no, I'm sorry, we can't. I need to pay attention to the agenda. We have to take see if there is a motion on the minutes from last month, March of 2022. Does somebody like to make a motion for that, approving the minutes?
I
Ms.
would.
Cobb? We have a second? I second. Anyone oppose or abstain from approving the March 2022 minutes? Say so now, please. Thank you. The minutes have been unanimously approved. Now we can go into the presentation from Mr. Chaim Gross. Thank you very much for coming here, Mr. Gross. I think I asked each of the presenters to try to keep their presentation to around 10 minutes. If you can do that, that would be great. This is on Heat Cool / Smart Brooklyn, Heat Cool Smart Brooklyn, HCSB. And it's nice to see you back, even if in the virtual format. Do you want to take the floor, Mr. Gross?
Yes, thank you so much, Brandon. Much appreciated. Nice to meet you all. I may have met some of you in the past because I know we've presented We presented to you, and we've also been the beneficiaries of your support over the years. Let me just try to share my screen, and let me know if you can see that.
I can see it.
Great. Okay, so I'm going to try to make this quick so we have a little time for questions and answers. I am the chair of the New York City 2030 District. We are a partnership of stakeholders, part of a network, as you'll see, of districts across North America. We are implementing Heat Cool Smart Brooklyn, which is a NYSERDA-funded Brooklyn Borough President sponsored program to implement clean heating and cooling installations in Brooklyn. We started in CBs 2 and 6. And we're now expanding through the end of this year to the rest of Brooklyn, or most of the rest of Brooklyn. So 2030 District is nominally bounded by a CB2 in downtown Brooklyn and Lower Manhattan below 14th Street. We have over 21 million square feet of property partners, some of whom listed here: Brooklyn Navy Yard, Pratt, Clinton Hill Co-ops, Time Equities, and others. And our job really is to bring the different sectors together, bring the stakeholders together in a collaborative way to address climate change without too much burden here. We know that 2 degrees Celsius is the ceiling that the Paris Accords have set for the top level we can reach in terms of global warming before we hit some pretty unpleasant permanent results. 2030 is the year in which they more or less unanimously say we need to start bending that curve down. These lines represent trends of concentration of carbon equivalent in the atmosphere. As you can see, they are not very promising unless we keep that green line, bend that green line down from about 2030 on. And that's our objective, to do this as a collaborative project at the urban scale. So the challenge for planning, the 2030 challenge for planning, which has been adopted by many industry organizations in the building industry and infrastructure industry, and many municipalities and governments, sets a 50% target from a 2013 a baseline for existing buildings and infrastructure, and targets carbon neutral or net zero for new buildings and major alterations by the year 2030. New York City and New York State have set also very aggressive targets. This is a bit more aggressive, but 2030, as we know, is happening very soon. We have 3 partner types: property, service, and community, and we work to get these different sectors to talk to each other. And as you probably know, in our siloed society and organizational structure, unfortunately, the different silos, the different sectors don't really talk to each other. We work very hard to get these different sectors to work together. We have 5 goals: innovation, resilience, equity, advocacy, and financing these goals. We're working on and we're primarily a volunteer organization. We're working to establish a template for a building energy performance report. We're using the Brooklyn Navy Yard 77, which is a 1 million square foot renovation. And by the way, some of you may know, the Brooklyn Navy Yard is partnering with Pratt and City Tech on a new project called the Research Yard. This will be an incubator and a kind of an academic laboratory for, among other things, green technologies, and we're hoping to work together with them to make this report a reality, and that reality, as I said, will be a template for all the other properties within the district and potentially beyond. Much more detailed than the benchmarking and other reporting that is required under New York City's regulations. So we connect the dots in the community and across the country. There are now 20 districts across North America, cities like Pittsburgh, Seattle, Toronto, Cincinnati, and others. All different, as all cities are different. So HECO Smart Brooklyn is, as I said, supported by our Brooklyn Borough President, funded by NYSERDA. We have, the project was launched more or less concurrent with the pandemic. So our timing might have been somewhat unlucky, but despite that, we've managed to complete installations in over 60 one-to-four family homes. We have engaged with, sorry about that. We've engaged with many multifamily buildings and some commercial properties. We just signed our first small co-op in Park Slope to start a what's called a flex tech study, or a dedicated building energy study, which will lead to will guide them to make energy improvements. As I said, and I want to really follow up on the excellent report that preceded our experience with COVID. I hope this isn't too much of a diversion, but our experience with COVID, I think, really shows that we need a collaborative approach, and it is perhaps kind of a dress rehearsal for what we will need to do to address climate change. We really have to, work together and take on, our individual responsibilities, our community responsibilities, et cetera, to meet climate change's demands. So we have a website, heybrooklyn.org. You can fill out a form, tell us about your property. You can volunteer. We have workforce training classes that are available online. We've held 20 webinars, done mailings and other campaign ads, and we're continuing to do that. Recently had a lunch and learn with the Brooklyn Chamber of Commerce, and working with other groups like 350 Brooklyn and Resilient Red Hook and others. We are promoting two primary solutions. One is building an envelope energy efficiency. You have to lower the energy demand from your building. You can do that with insulation, with air sealing. The image on the left there is a blower door, which tests the air tightness of a building. And that saves you energy and potentially can save you money, both in heating and cooling your building. And the other principal solution is cold climate air source heat pumps. You may be familiar with these mini splits you see around. There's an outdoor unit, a number of indoor units. Heat pumps are really efficient. They're easy to control. And the only way for us to remove those fossil fuel boilers on burning oil, mostly gas, in our buildings, we say stop burning fossil fuels in your basement, is to replace them with air source heat pumps. But as we know, despite Putin's best efforts, gas is still relatively cheap. Electricity is pretty expensive in New York City. And the grid is not yet clean. So we're working on cleaning the grid. That's a real effort being made to bring in offshore wind and increase solar. We will work with you and your properties to install solar. We're working on community solar with a number of our partners as well. But the basic concept here is you can replace that fossil fuel boiler, you can turn it off, you can install an air source heat pump or a larger system for a larger building called VRF, a variable refrigerant flow. These work really well, very efficiently, and they can heat even down to, below zero. If the air outdoors is below zero, these will still draw air from that ambient outdoor air and make heat. And we've had very few complaints on the projects that we've completed. But still, in order to make this work and maybe to make it pay off, you have to insulate and air seal the building. It's something we have a challenge with. There are very good incentives from Con Edison for these installations. If you take your fossil fuel boiler out of service, their incentives are even higher. And there are even some incentives for the air sealing and envelope improvements as well. We work with residential, commercial, and multifamily buildings. Again, heybrooklyn.org. You can fill out a form. We'll get in touch with you and get you going on a retrofit. You can also contact us at Smart Brooklyn, hcsb@nyc2030.org. So I hope there's a minute or two for me to answer questions. I think I maybe overshot my 10 minutes. Sorry about that.
It's all right. We try to be somewhat considerate, but thank you so much for your presentation and for your efforts in this area. Great. I know you've been before the committee a few times in the past. It's great to hear about what's going on in this regard, and we'll really look forward to hearing how much more successful it becomes in the future, because we have to become more successful at addressing this challenge. Any questions from members of the committee for Mr. Gross? Well, I have one. I'm
Please.
wondering, in your efforts to kind of go around and build this process out and create these better compliance with the reality of our future, are you having a greater challenge with larger buildings that have large maybe large tenants or commercial buildings, or more with small private property owners, brownstone owners who are reluctant? Where do you think the biggest leap needs to be made, and for us as a community to have a better and more comprehensive approach to addressing this challenge?
Thank you for that question. The challenge is because of the complexity and because of the sort of disconnect between the regulations and, in fact, now through Local Law 97 or the Climate Mobilization Act, the mandates which are upcoming through New York City's pretty stringent local law, set of local laws. The challenge really is the multifamily buildings. And so even though you have, in rare instances, I have to say, very rare instances, you have multifamily properties that really walk the walk. Clinton Hill Co-ops is one such large property that does fantastic work. They're actually they've completed a window replacement with a fairly high performance windows, and they're nearly completed with what's called a Radiator Labs, a Radiator Cozy installation across all of their 1,200 units. Radiator Labs is a very successful innovation which allows the steam radiators, which, as we know, are really provide uneven heating and are generally don't satisfy people's needs across across a large building. Radiator cozies put essentially an insulated box around the radiator itself. They're smart. They can be controlled. They don't allow heat to escape where it doesn't need to be to escape, and therefore it can be distributed more evenly throughout the system. They have sensors on them, etc. So there are innovations. There are things like window skins, which help you improve the insulation in a window without replacing the entire window. There are solutions, but as you suggest, property owners, property managers, co-op boards have many decision makers. The metering and of the electricity throughout a building might be a master meter, might be an individual or sub meter. There isn't a straight comparison between replacing a heating system with now a heating and cooling system, right? So there isn't an apples to apples comparison. You're converting from gas to electricity. How do you adjust the common charges? How do you adjust the rental costs that are dedicated to heating? So there's a lot of issues. And I have to say that the city has not addressed this, has not provided the guidance, has not provided the solutions. We try very, very hard to provide this, but we're, as I said, a volunteer organization, and we have begged and pleaded NYSERDA to address this. We are doing our best to address through the elected officials to get some movement on this, but I have to say that the pandemic kind of derailed what communication and what progress there might have been to address this particular issue, and also more broadly to get the comprehensive solutions, the integration of these different solutions to work together. As you can imagine, the different funding and tax abatement and other programs are disjointed.
So what more funding or guidance could the city do from your perspective?
The city could provide for first of all, a comprehensive public education and engagement campaign, so people understand, that instead of just getting a law that says you've got to improve your building energy performance and reduce your greenhouse gas emissions by X by 2024 or by Y by 2030, which is effectively what they've done, allow for the stakeholders to really have a better understanding of what the challenges are, and is something that we've worked on doing. We submitted a proposal to the city council a couple of years back that went south when the budget went south for a sustainable community toolkit. Public education is valuable, and then empowering and providing the wherewithal for community groups who are really the ones who can reach out to these property owners and to the stakeholders to have the means to facilitate these programs. The incentives do exist. The utilities don't make it easy. If NYSERDA has 15 different programs for 15 different types of buildings, it's impossible to navigate. And so the means and the capacity for the public to be educated, and then for the community groups to provide this guidance are really what's important.
That's great, thanks. And I want to ask Ms. Einhorn a question, and then I'll ask members of the public and board members if they have a question. We could probably take maybe 2 more questions here. If you can, just raise your hand. We can get to it. I see Ms. Weary has her hand up. Ms. Einhorn.
Thank you. I mean, I would argue even a step further that the city could mandate that new development is required to do environmentally friendly heating and cooling systems.
They've done that.
Yeah, well, yeah.
To some degree, yes.
To some degree. So actually, my question is actually for Brandon, because I think one of the things that we should be doing when ULURP applications come in front of us is that we should be asking this question. And so I'm wondering if this is just something we can coordinate with the land use committee, because there's so many other questions that we've added to their list over the years, whether it's that they're providing places for bikes to go, or, like we're providing thresholds for affordable units. And I think this is just one of those things that could be added to the list to make sure we're doing our due diligence.
I think that's a reasonable idea. And I mean, Mr. Gordon will have to have a voice in this conversation as well too. But it's worth discussing. Absolutely. Thank you for that idea, Lindsay. Ms. Albert, Weary.
Yes, thank you. Mr. Gross, what are the arguments for doing these split units, considering the high cost of electricity in New York City, number one, and then number two, the heat experience with them is not quite the same as a circulating hot water system.
Well, thank you for that question, and you are absolutely right. There are some challenges. In fact, the heating that is produced by these units has improved greatly over the years, and they are now really quite high performance. I mean, the program that we are facilitating is actually a program that was developed upstate for single-family homes. And so these units are performing in colder climates than ours. And one benefit is that they really do provide heating and cooling fairly efficiently, or very efficiently, despite the cost of the electricity. The reason that we push the building envelope improvements is that that's the way to lower greenhouse gas emissions, by lowering your energy use. So if, as we have in New York City right now, a dirty grid, New York City is burning, the New York City grid is now, since Indian Point is closed in the last few years, has now been taken out of service. Our power plants are 90% fossil fuels. So it's energy efficiency, it's insulation, it's air sealing that make the difference. That's the only way to really lower the operating cost, both in heating and cooling. And yes, if you can do solar or community solar, another conversation is community scale work, like a community solar farm, which we're starting to see in New York City, or things like aggregated projects. We're working very, very hard to get the suppliers of this equipment. We're just talking to Train, for example, which is merged with Mitsubishi, to get them to say, hey, if you guys can do 100 projects in a couple of months, we'll give you an additional discount, those kind of things. So it's the collaborative, the aggregated work, the sort of the integration of the solutions, and in this case, air source heat pumps, building envelope improvements, and possibly solar, that really make the difference. And yes, I understand it's not accessible enough, even though there are very, very generous incentives for low moderate income buildings. It nearly covers the entire cost, but it's the access to what is really a complicated process to switch out the heating system for another system. And let's face it, every time you reach the point where your boiler's on its deathbed or on its last legs, and you replace it with replace a gas system with a gas system, that gas system is going to be there for 20, 25 years. You're not going to ever change it. So we have to get these buildings, as we are now talking to about 25 or so multifamily buildings of different sizes, in addition to hundreds of single family homes or 1 to 4 family homes. We want to break that cycle, and instead of having them replace their system with another fossil fuel system, we want them to replace it with an efficient electric system, and then we work to clean the grid and hopefully to achieve some community scale improvements. So yes, it's not an easy answer, but we're working because we think that's the long-term solution.
Thank you, Mr. Gross. And thank you again for coming and speaking with us this evening. This has been really wonderful, and I think there's definitely some things that we can take away from this conversation.
And appreciate it. And if anybody has a property that they'd like to us to look at, just reach us at heybrooklyn.org and fill out a form. And thank you, Brandon. I really, really appreciate it. And hopefully we'll be talking to you and other members of the board soon.
Wonderful. I hope so too. Thank you very much. We're going to move along to the next part of our agenda, and we're honored to have 2 speakers this evening. Do we have Ms. Marshall and Ms. DePulu on the line tonight?
Yes, we do.
Wonderful.
Hello?
Yes, I can see you. I can hear you. Thanks so much. We're here to talk about Gotham Health Cumberland, and I'd be willing to give you the floor and let you go. But thank you very much for coming and telling us a little bit about yourself. As I told Mr. Gross, I'm not going to be too stringent, but if you can try to stick to around 10 minutes for your presentation, that'd be great.
Okay, thank you so much. Good evening, everyone. I would like to thank Community Board 2 for this opportunity to attend this evening's Health, Environment, and Social Services Committee meeting. My name is Delicia Marshall, and I am part of the Community Affairs Department for Gotham Health. My role as a community coordinator allows me the opportunity to connect with boards and committees such as this. We understand the importance of establishing partnerships with our community boards. It's a great way to get information out about our services, and it's also a good way to get information about what the board thinks the community's needs are so that we can align our services with the needs of the community. I am here this evening with our Deputy Director of Ambulatory Care Services, Ms. Rula DiPiola, and also Mr. Rafael Dominguez, who is our new Community Affairs Director, Director for Community Affairs and Patient Growth. So they're both on the line. I would not go take up too much more time because Ms. DiPiola has a wonderful presentation. Ms. DiPiola, if you can hear me, the floor is now yours, and then Mr. Dominguez will speak afterward. Thank you.
All right, good evening, everyone. Thank you again for having us. So what I'm going to do is I'm going to go ahead and share my screen so I can share the presentation, okay? All right, can everyone see the presentation?
Yes.
Perfect. All right, so again, thank you so much for having the Cumberland team. My name is Ms. Worola Dipeolu, and I am the new administrator at Gotham Health. All right, so who we are. Gotham Health is, of course, is an NYC hospitals, one of the largest public healthcare systems in the country. Gotham Health is the ambulatory arm of HHC and one of the largest federally qualified healthcare centers created in 2015. Our primary goals is to address primary care and preventative care needs of families and individuals in their own neighborhoods. And we do service all communities throughout all 5 boroughs. We consist of 6 large diagnostic and treatment centers with 20 smaller neighborhood healthcare centers located throughout all 5 boroughs. We deliver high quality healthcare services with compassion, dignity, and respect to all New Yorkers without exception, and we mean all. We promote healthy lifestyles and build healthy communities, one family at a time. Sorry, I'm just going to go to the next slide. All right, who is Gotham Health Cumberland, i.e. the best? We are located in the Fort Greene and Clinton Hills neighborhoods. We are right at North Portland and Park Avenue. Cumberland continues to aggressively adopt, innovate healthcare strategies to facilitate positive patient outcomes. Our patient satisfaction score are amongst the highest throughout our organization. A little bit about our hours of operation. We are open Mondays through Saturdays. Mondays, Wednesdays, and Thursdays, of course, is our later days, anywhere from 8:30 to 7 p.m., which includes primary care services, as well as OBGYN and pediatric services. Tuesdays and Fridays, we are open from 8:30 to 5 p.m. And we are open every first, second, and third Saturday of the month from 8:30 to 4:30, where we do offer pediatric services as well as internal medicine services. Oh, in addition, our pharmacy is open that day. All right, so our services that we offer. So just starting down the list, we do offer pediatrics, women health, family planning, optometry, general medicine, social work services, podiatry, virology, radiology imaging, pharmacy services, behavioral health, and chemical dependency. In addition, we do have our own testing site that we are still offering vaccinations And our vaccinations are Monday through Friday from 9 a.m. to 7 p.m. for those who get out of work late. In addition, Tuesday, Wednesday, Friday from 9 to 4. And our COVID-19 testing hours are Monday through Friday from 9 a.m. to 4 p.m. Okay, we literally see everyone. We do not turn anyone away. We provide many options for healthcare and provide care regardless of financial situations or immigration status. We accept most insurance plans and offer discounted fees for those uninsured and underinsured. We offer discounts on prescription medications and can be picked up at our on-site pharmacy. Yes, we are one of the HHC facilities that have an on-site robust pharmacy at our location. In addition, we offer on-site financial counseling, Metro Plus representatives, which are on site to help enroll uninsured patients into their insurance plan. In addition, we do offer NYC care services. So this is for patients who are unable to become insured based off their level of income. And we offer our services at a well-discounted rate. So when I say Cumberland, we do not turn patients away, we do not at all. Our facility provides immediate translation services free of charge to all or with limited English proficiency, and addition to sign language, people needing sign language services. And all services are offered in real time during the time of service. Okay, so support beyond traditional healthcare. Our amazing outreach department, which is led by Ms. Marshall. The community fairs team, they host a bunch of outreaching events, health fairs, in addition to open houses. We do screenings and additional social work services. And our social work department is so integrated within our system. Currently, one of our newer organizations that we are partnering with is the Beacon Children's Organization. We're having a playwriting event to support victims of gun violence, my apologies, and that will be on April 20th. So if you are looking for more information, I can forward that over to Ms. Marshall and she can get that over to you and your team. Okay.
That would be great. And just, I want to note that our committee is planning to plan a health fair for the summertime this year, and it'd be interesting to speak and see if there's any way that your organization might be able to be involved with us if possible.
Absolutely.
We would love that opportunity to attend to tables. So when you have a date in mind, when you've solidified a date, you can send that information over to me. I will let the team know, our director know, and then we'll have someone come out and be able to support your event. And we can talk further, maybe if there are other things that we can do. Sometimes we may try to do some sort of screening, but we could talk offline about that once you have a date in mind when you're going to have your health.
That's wonderful. Yeah, if you can just make sure that you get the contact information to the board office, that would be great. But I don't want to hijack your presentation. I just saw you mention the same topic that we were thinking about here.
No, it's not a problem. To be completely honest, that is the end, and we are now open to questions.
Okay. Well, thank you very much. It's nice to hear about your services. I'll open the floor to the committee and ask if there's anyone from the committee who has a question for the folks from Gotham. I will further open it to the members of the board and members of the public as well too, just for time, because I know we're running a little behind. I did have one question I wanted to raise, but I will defer to anyone else. My one question is, do you all offer prenatal services? And if you do offer prenatal services, do you use midwives, or how do you ensure that folks who are women in need of care get adequate advocacy for their health interests?
Absolutely. We have our sessional physicians on site. We do partner with our, I call it the sister hospital, Woodhull Hospital, just regarding prenatal services. We utilize MDs as well as NPs to see our patients.
Okay, Ms. Cumberbatch. And Ms. Cumberbatch, I'm sorry I didn't recognize you. Feel free to introduce yourself. We're happy to have you here this evening.
Thank you. Good evening. My name is Monique Cumberbatch. I am a member of Community Board 2 and a member of the committee. I was wondering if you partner with the home visiting program for new moms.
Ms. Marshall, are you able to confirm that?
Yeah, hey, let me hit my unmute button. That information, we'll double check on that one, and then I can get that information back to the board by tomorrow.
Okay. Basically, it's like a program where there is someone who does home visits with expecting parents to help them before the birth and after. So, it's a good resource. If I can find the information, I'll put it in the chat.
Perfect. Thank you so much.
Thank you for raising that, Ms. Cumberbatch. I feel like that's another important thing to draw attention to. Any other?
Yeah, sorry. I know it's through, I know the Department of Health and Mental Hygiene is starting to work on that. So they're partnering with them as well, but they've been around for a while.
Okay, like Ms. Marshall said, we'll look into it and we can give more feedback and follow up with the group. That's actually a really good program, to be honest.
Great. Any other questions for the folks from Gotham? All right, well, we'll look forward to working with you further in the future and hearing more and particularly the feedback on the questions that were raised. Thank you very much for your time and for your presentation this evening.
Thank you so much for having us.
Thank you so much. Have a good evening.
Good night.
All right, I'm going to move forward in the agenda of tonight's meeting into our liquor license application reviews. The first item on the agenda tonight is 330 Myrtle. I believe the title is Glin. Do we have someone here from that location? If that is you, Miss Pulong, having a little.
Hello, community board. My name is Huang Limbak. So we represent from Glin Thai restaurant.
Thanks. So it looks like this is going to be a Thai restaurant. Are you newly open? You're going to newly open your Thai restaurant?
Yes.
When do you plan to open?
Actually, we work on it about like the paperwork. With like we have to talk with the landlord with for sign the lease.
Okay, so you're still figuring that out. But is it going to be sometime in the next couple of months, or does it look like it's going to be longer than that?
Maybe like it would take like a couple months, I think.
Okay.
Yeah.
So your plan is to be open until 10 p.m. every night of the week?
Yes, we will open like 12 p.m. until 10 p.m. Yes.
Okay. Do you have any outdoor seating?
No, I don't think we have it.
Well, yeah, you don't have it on the application. I just wanted to make sure. And what's the cross street over there on Myrtle Avenue?
What
Is it between Carlton and Washington Park?
Yes.
Okay. All right, and you're not going to have any music whatsoever? No, not even background music?
No.
Okay. Great.
I'm sorry. Yeah, you mean the background music, right?
Yes.
Yeah, we will have the background music, but we don't have the live music.
Okay. If you can just maybe submit an updated application to the board office. It says no background music right now. So it sounds like you do want to have background music. We made a note of that. have you spoken with any of the neighbors in the area?
Yeah, we spoke with the neighbor area and let them like sign the paper that they agree that we should have the bar, like open the full bar in the restaurant.
Okay.
Yeah.
Now, did anybody express any concerns from the neighbors? Anybody concerned about the opening of and the serving of liquor in your?
No, they agree with it. Yeah.
Okay. How many people do you intend to hire?
Like how many people, right?
Yes.
I think I like more than 5.
Okay.
Yeah.
I'm going to ask you, it's not a condition of the committee's vote, but you intend to hire from the local community? Know that we have high pockets of poverty in our community, and there are lots of people who need work, particularly folks who are Black and brown. And we have resources that people can go to, like Fort Greene SNAP and Ingersoll Community Center and Brooklyn Navy Yard, where there are job fairs and where there are job applicants, and not just for you, but really for everybody here. Hearing all of that, do you feel like you're going to try to hire locally from the local area?
Yes.
Okay. Any other questions for the applicant from the members of the committee? Questions from members of the board or members of the public? All right. Hearing none from either, does anybody like to make a motion for this application?
Motion to approve this application.
Ms. Anadu votes to approve or moves to approve. Do we have a second?
Approve, motion move to approve.
We have a second from Mr. Andrews. Any discussion? All right. I vote in favor. Ms. Anadu, how do you vote?
Oh, sorry, in favor. Apologies.
Thank you. Ms. Cumberbatch?
In favor.
In favor.
Okay, I've got Mr. Andrews also in favor. Ms. Cobb? Ms. Cobb is in favor. Ms. Einhorn?
In favor.
Ms. McKnight?
In favor.
Okay, unanimously approved. Thank you very much, Ms. Puwong. Good luck with your new establishment.
Thank you so much.
All right. Next up on the agenda tonight, we have 25 Bond Cafe Plus. Do we have somebody here from that location?
Yes, hi, good evening. Can everybody hear me clearly?
Yes.
Okay, good evening, everybody. My name is Neil Visaki, the attorney for the applicant for Cafe Plus. I saw all the questions were pretty much answered correctly in the questionnaire, so I'll just talk for a few moments. My client, Mr. Karoma, has 2 other restaurants, Cafe Plus, 1516 Fulton Street, 7 McDougal Street. This is going to be a fairly small place, under 800 square feet. Extensive American cuisine. It's going to be a full restaurant. They have a full kitchen. Only background music, no live, no DJ, no amplified, no outdoor area. There's really no residence below, on top of, to the side of. It's in a big commercial building. Their hours will be Monday through Sunday. They have a big breakfast menu. They'll be open at 10 a.m. till 2 a.m. They have 21 tables, 49 seats, 8 bar stools. And it's pretty much all I have. It's a pretty straightforward application.
Okay. It's a corner of Bond and Livingston. Is that correct?
It might be Skimmerhorn. I'm not too familiar, but I think I saw on the diagrams. Actually, Bond and Livingston. Yeah, that's the way it looks, sir.
Okay.
Yeah.
That's great. And you're here for the applicant. Is there nobody else here who's representing the applicant tonight?
Well, it's just myself, the attorney.
Okay, great.
Oh, no, he's not here. I'm sorry.
Yeah. I understand. And it's 2 a.m. 7 days a week
Yes. Mhm.
and no outdoor.
Correct, no outdoor.
And
Mr. Chair?
Excuse me?
we have a question from the member of the committee, but let me just
Sure.
ask for committee questions first. Mr. Andrews, do you want to ask your question?
Can I do it now? You want me to wait?
Sure, sure, go ahead.
Question, is your restaurant wheelchair accessible in and leaving, as well as an accessible bathroom?
I didn't hear the first part about leaving, but there is a, I'm looking at the diagram, yes, what was the question, sir? I'm sorry. I'm
The
looking at
question is basically, do you have ADA, are you compliant with Americans with Disabilities Act in terms of your entrance, in terms of your bathroom? Can somebody with a wheelchair get in and out and use the bathroom effectively in your establishment?
Okay, well, I apologize. I can't answer that question right now. I've never really been asked that, and I don't have the correct answer, so I'd rather not answer that question right now. I just don't have the answer for that.
Oh, okay. We don't, so you don't know. That's fine.
No.
Well, I'm expecting to come back to either Brandon or the board officer with an answer.
Well,
I'm gonna speak to my client tomorrow, and I'm gonna certainly let them know that's a concern.
well,
Okay, got it.
thank you from everyone. It's appreciate you making the effort, Mr. Visaki, and we'll look forward to hearing about that. I want to see if there's any other questions from the members of the committee. Are there any other questions? Any questions from members of the public or the board? I wanted to just ask the same question I asked the other applicant, given the to be consistent and also because it's a concern, is does the applicant intend to hire from the local community for this area? And is there any idea how many people they intend to hire?
I don't have the answer to that as well. These are unique questions. I've been doing this for like 13 years. I'm sorry, but never been asked these questions. So therefore, I just didn't have an opportunity to ask them of my client. But I will certainly convey to my client that it's a preference and it's an admirable thing to obviously hire from within the community. I don't think there'd be any opposition to that. I mean, if there was a way that if you give me website or if you give me some information, I could pass that on.
Absolutely.
Yeah.
Absolutely. We should be able to give you some information, particularly the Fort Greene SNAP, Brooklyn Navy Yard, and the Ingersoll Community Center are good places to go to. And this is not in any way a condition on how we vote, but we just want to make these resources available and want folks to know that these are issues that we have in our community. And there are a lot of people who need a job and could really benefit. Do you happen to know when they plan to open?
I don't know. I didn't get the full application in front of me. Just like step by step. I usually just come in front of the community board.
Gotcha.
At that point, the client comes in, gives us, all the documents, and we kind of just take it step by step. So I think the place is pretty much well built out. So I think we're going to be filing pretty shortly.
Okay. Does anyone want to make a motion?
I want to ask a question.
Oh, Ms. Cobb, of course.
Yes, isn't it required by law to have access for those people in wheelchair, or isn't that a legal issue? Before we vote on it.
Mr. Visaki, if you can just hold on for 1 second.
Sure.
Well, when it comes to our voting as a committee, it's not our committee to decide it's not our role to decide whether or not the location is in compliance with federal law in this case. It's strictly a matter of concern that's expressed from the standpoint of the community, whether or not the applicant is taking steps to be to allow their establishment to be accessible to folks who might have a disability. There are requirements of law that relate to that, and I'm sure Mr. Basaki is looking into that as a representative for the applicant. But our focus is not necessarily on the requirements of law. It's on the ability for the applicant to demonstrate that there are no concerns from a community perspective.
Okay. Gotcha. Thank you.
Any other questions for this applicant, an application? All right. Does anybody want to make a motion?
Motion to approve.
Motion to approve from Ms. Einhorn. Do we have a second?
Second.
Second
Yep.
from Mr. Andrews.
Thank you, sir.
Any discussion on the motion? Hearing none. I vote in favor of this application. Ms. Cobb, how do you vote?
In favor.
Okay, Ms. Einhorn,
In favor.
Ms. Anadu.
In favor.
Wait,
Him too, but sure, in favor. Yeah.
okay, Mr. Andrews and Ms. Anadu have voted in favor. Ms. Cumberbatch,
In favor.
Ms. McKnight,
In favor.
I believe I've got everybody. Thank you very much. Good luck for your client's new establishment.
Thank you. And I can assure you tomorrow, I'm going to address those two issues with him. The hiring within the community, and of course, I'm hoping, of course, that it will be wheelchair accessible. So I'll look into that.
Great. Thank you very much.
Thank you very much for having me. Have a nice evening.
Excellent.
Bye now.
Next, we have 895 Fulton Street, Vessel. Do we have someone here from that location?
Mr. Chair, Vessel is not prepared to present and requested to be laid over to May.
Okay, we will
the
move to the next
office-
step of the. I don't want to cut you off, Ms. Mueller. Please go ahead.
We'll talk about it in May.
Okay, that sounds good. Moving along the agenda is much appreciated this evening. 117 Adams, Hungry Angelina. We have someone here from that location.
Yes. Hello.
Can
Can you hear me?
Yes.
Okay, cool. Sorry. I don't want to make you jealous. I'm in California. It's really nice outside. It's like 90 degrees. So.
Well, I think you failed in that regard, but can you go ahead to give us an overview of your place, and what's the
Yeah.
cross street on Adams Street?
It's right off the Manhattan Bridge. It's like Sands and Prospect and Adams, like that whole intersection. It's the Etsy building over there.
Okay.
Great. Yeah, we actually went in front of the board 2019. And then because of COVID, we got extensions and we got approved by you guys. We got approved by the Liquor Authority. We were going through the entire process, and then we exceeded our extensions because of COVID and delays and everything like that. So basically, it's a vegan restaurant. We have 4 in the Lower East Side of New York, and then we just opened up a small vegan cafe in also in the city on 31st Street and Broadway. And then this is our Hungry Angelina concept. We have this concept open currently in Long Beach in like a mall setting in Long Beach in California. And it's vegan food, it's a full bar. It is a big bar. I believe there's 16 seats, but it is right by the bridge. It's a commercial building, should be exciting and fun. Yeah, just really good food and everything, all plant-based, sustainable like the rest of our company. And that's pretty much it. I have a menu and everything. If you guys want to see, it's all online. I could share my screen with you, but it's like it's a mixture of like the junkier burgers and vegan food together with some of the, more refined to kind of bring everybody in who more seasoned vegans, and then people who aren't as used to it to kind of comfort food for them, some alcohol, bring people in who don't really care about plant-based food and bring them into that whole experience.
Okay. And you're 1 a.m. Thursday to Saturday, 11 p.m. the other nights of the week?
No, we are 10 p.m. During the week and 11 p.m. on the weekends.
Okay.
All right. We just don't, not that we want to sell ourselves short, but we don't really have like a late night type of crew. We're more like daytime brunch and then just like an earlier dinner and people drinking with their meals. So.
Oh, okay. That makes sense. Yeah, sorry. I think I
Yeah.
was looking at the wrong application here.
That's okay.
All right. Questions from members of the committee?
Mr. Chair,
Mr. Andrews?
you already know what I'm going to say, so can you handle that for me?
Sure, I can ask you. Mr. Andrews would like to know whether your location is ADA accessible.
Yeah,
and
there's
whether
an
it has
ADA
accessible.
There's an ADA lift that's from the building, and then the bathrooms are ADA accessible. So
Great.
Yeah.
And to be fair, what is the status is you were you have not opened yet. You were going to open, but then with the pandemic and everything, you didn't open.
yeah, so there's only a certain amount of extensions you can get to give them your CO.
Right.
So we just
So-
never finished.
So when do
right-
you plan to open, and how many folks do you plan to hire?
The plan is optimistically to open in July. We're just waiting for inspections at this point. So it's really just on the city. We're good. They finished all the work. The contractor got back in there in February. We're gonna be hiring a lot of people, and we'll definitely need to hire locally. It's a fairly large restaurant. So we, total will employ at least, 50 full-time, above 30 hours people, and then probably several part-time people. And if you could repeat to me where we can find, because we had a lot of success in the city with the, there's 2 homeless shelters right by our spaces, and we've had a lot of success hiring people from there and other people from the community. So I think you mentioned SNAP, you said?
Yeah, there's Fort Greene SNAP is one. There's also Ingersoll Community Center, and Brooklyn Navy Yard. Those are our 3 spots.
Okay, great. Yeah, it's really hard to.
And it looks like the board office has put the link to at least Fort Greene SNAP here in the chat.
Oh, thank you.
So were there any other questions from members of the committee?
Not a question, but may I make a comment, please?
Sure.
Matthew, it's so nice to hear that in the past you've hired from homeless shelters, and as Brandon said, that obviously it's not a condition, but it's awesome to hear that. So thank you for that.
Yeah, it's nice to find people who want to work, and it means a lot to them, to earn a wage, especially people who are in the program and they just come into the program, right, and they want to graduate to have their own housing and everything like that. So we've seen people through that whole process. Unfortunately, in the city, then where they get their permanent housing, it's usually too far to travel, so we lose them, but at least they move on to that part of their life. So it's good.
Thank you. Any other questions from members of the committee, members of the board, or members of the public? Hearing none.
Motion to approve.
Second.
All right, we got Ms. Einhorn and Ms. Sanadu. Any discussion? All right. I vote in favor. Ms. Sanadu, how do you vote?
In favor.
Okay, Ms. Einhorn,
In favor.
Mr. Andrews,
In favor.
Ms. Cobb,
In favor.
Ms. Cumberbatch,
In favor?
and Ms. McKnight.
In favor.
Okay, unanimously approved. Thank you very much, Mr. Bromfeld. Good luck with your new establishment.
Thank you. Have a good night.
Next up on the agenda is 78 Rockwell Place Coffee Project. We have someone here from that location.
Yes, I'm here. And then also Chris Dunlop is also on the call as well to answer any questions that may come up too.
Yeah, hi there.
Okay, you want to tell us a little bit about your place?
Sure. So similar to the last applicant, we actually presented to you all 2 summers ago, summer 2020. The SLA had reapplied due to entity since Coffee Project is already open, and we'll be partnering with them to open the bar in the evenings. So that's why we're back in front of you. The application is exactly the same seating as it's already open. We are looking to the coffee shop is open at 7 a.m., but we'll be opening in the evenings. And then on the weekends, we wanted to have that option to offer brunch cocktails at 10 a.m.
Okay. So I guess then, like the other applicant, you haven't opened yet, but you're planning to open soon.
So the coffee shop is already open. It's been open for a little over 3 years.
Okay.
But the bar obviously is not open, but it's ready to open. We've built it out.
Gotcha.
So that's all ready to go.
Gotcha. Okay. Questions from members of the committee? Questions from members of the board or the public?
Is the bar going to be located in the same site as the coffee shop?
Yes, it will be. So there will be about an hour closure between the coffee shop and the bar for setup. But otherwise the same exact space, yes.
Okay, thank you.
Did you say you're going to have private events at your location?
We would like to offer the option for buyouts, since it's a local, we're local to BAM, of course, and Tafana. So we'd like to have that option. I know one of our local places, the Rockwell, they do a lot of events with BAM and Tafana as well, opening and closing parties. So we would love to have that option if possible.
Okay. And you don't have any residents living above, below, or near you?
No, there are, I put on the application, there is 66 Rockwell, so 2 buildings over, and then there's 98 Rockwell, which is a couple of buildings over as well, have residents, but we have had the local residents sign in support.
Okay. Any other questions for the applicants? Hearing none, does anybody want to make a motion? Well, I'm going to move to approve the application.
Second?
We have a second from Ms. Cumberbatch. Any discussion on the motion? Hearing none. I vote to approve. Ms. Cobb, how do you vote?
Approve.
Okay. Ms. Cumberbatch?
Approved.
Ms. Nadu?
Approved.
Ms. Einhorn?
Approved.
Ms. McKnight?
Approve.
And Mr. Andrews?
Approve.
Okay, I think that is unanimous. Congratulations again, and good luck
Thank you so
once
much.
again with your new place.
Thank you very much.
With your new service.
Thank you.
Thanks so much.
All right. Next on the agenda, we've got El Zason, 491 Atlantic. We have Ms. Hoffman or someone else.
Yeah, you got just me today.
Okay, well, it's absolutely fine. If you want to hit the highlights here, as I understand, this may be similar or very little changed from May of 2021 when we approved this application.
That's correct. The only changes is another one that essentially you've heard before. The only difference is we actually came before you before. Although it looks like this one is now checked liquor, beer and wine. We actually had come before you for full liquor, and then in an effort to help them open earlier, we have initially downgraded to beer and wine. So this is now proceeding as a beer and wine only. So the only change is actually that we're taking out the liquor for now, and we'll come back to you eventually to upgrade back to liquor.
Okay. And let's see, you have no outdoor seating, at this location?
Yeah, he's not using any outdoor seating. Yeah, he's not using any outdoor seating. I mean, he's open. They have a handful of employees. He's in the kitchen and in the place himself, which is why I told him he could keep working today and I would take care of this
Gotcha.
meeting.
All right.
So,
Any
yeah.
questions from members of the committee? Any questions from members of the board or members of the public for this application? 191 Atlantic, L Zason.
Sorry, I didn't get to my unmute button fast
Oh,
enough.
go ahead, Ms. Montague.
So, hi, Ms. Hoffman, thank you for coming in to present. So obviously, as we've mentioned to others that have come before us, it's not a requirement, but just again, would love to encourage local hiring in Brooklyn, particularly Brown and Black people need help and support and jobs. So the resources have been posted in the chat, but obviously you can reach out if you want to get in contact if any of that's of interest to you.
Yeah, and I think, just to add, this whole venture sort of started as a way, it was like a pop-up mid-COVID to try to keep some people employed who had lost their jobs in the neighborhood. So that was kind of the genesis even of this kind of pop-up project. And it had some teeth and they decided to make it permanent.
Thank you.
Any other questions for the applicant?
Mr. Chair.
Ms. Hoffman, could you remind us as to what the status of your ADA accessibility is?
I have been over there. They do have an ADA accessible bathroom on the ground floor. I couldn't warrant the ramp or entrance right now offhand, but I have been in there and there is one ADA bathroom at least on the ground floor of the establishment.
Okay. Does anyone want to make a motion for this application?
I make a motion to approve.
Thank you, Ms. Cobb. Any second on Ms. Cobb's motion?
Second.
Second from Mr. Andrews. Any discussion on the motion? Hearing none, I vote in favor. Ms. Cobb, how do you vote?
In favor.
Ms. Anadu?
In favor.
Mr. Andrews? I think you said in favor. Is that correct?
In favor, yes.
Okay.
Yes.
Ms. Cumberbatch?
Approve.
Ms. Einhorn?
Approved.
Ms. McKnight?
Approve.
I think that's everybody. Congratulations, Ms. Hoffman, and to the applicants, and hope that things work out for you all there. Next up this evening, we've got 445 Albee Square West, Pulkies. We have somebody here from that location.
Yes, hello, Nick here.
Hello, Nick. You want to tell us a little bit about your establishment?
Sure. Hi, everyone. I'm Nick. I'm one of the managing partners of Pulkies. My partner Harris and I opened in DeKalb Market Hall in November of 2020, where we currently and still operate a kiosk and are looking for our beer, wine, and cider license. It's our understanding that the licenses are typically administratively approved. However, we are happy to be here and answer any questions you guys may have for our kiosk in DeKalb Market. And to just get ahead and answer your question regarding hiring locally, our entire team is from the community. It's a win-win situation for us when the team member has a short commute. So our entire team is from the community.
Okay. Any questions from the committee for the application?
Where's it located?
So the address is 445 Albee Square West inside the City Point Mall. So the cross street is Willoughby and Flatbush Avenue.
Okay.
Yeah. And I think what he said, and correct me if I'm wrong, is this is a kiosk within the DeKalb Market Hall. Is that correct?
That is correct. That is correct.
Any questions or concerns from members of the public or other board members for this application? Hearing none, I make a motion that we approve this application. Is there a second?
Second.
Second from Mr. Andrews. Discussion on the motion?
In favor.
Well, thank you for that. I'll take that as your vote, Mr. Andrews, because we're going to start voting here. I vote in favor. Ms. Cobb, how do you vote?
Yes, in
Ms.
favor.
Einhorn?
In favor.
Ms. McKnight?
In favor.
Ms. Anadu?
In favor.
Ms. Cumberbatch?
In favor.
I think that's everybody. Congratulations and good luck with your new establishment.
Thank you. Thank you for having me.
Thank you. Next up on tonight's agenda, 162 Montague, Ding Soup Dumpling. Do we have somebody here from that location? Anybody from 162 Montague? Going once, going twice.
It's a shame if they're going to be laid over. They actually received 115 petition signatures and a letter of support from the Montague bid.
Well, you still got to show up. So we'll see if they come and we can go back. The next one on the agenda is 30 Lafayette, Brooklyn Academy of Music. Do we have someone here from that location?
Yes, good evening. Max Bookman, attorney for the applicant. May I proceed?
Yes.
Thank you, Mr. Chair. Good evening, everyone. Again, my name is Max Bookman. I'm an attorney. My firm is Pazetsky and Bookman, and we routinely represent businesses before your board, including Pulkies that you just approved. So thank you for that. With me is Elizabeth Moreau. She is the interim co-president of Brooklyn Academy of Music, better known to everybody else as BAM. This is an application for a beer and wine license for the cinemas at BAM. About a little over a month ago, the State Liquor Authority issued a new interpretation of the law that allows for movie theaters to have beer and wine licenses. No full liquor, but beer and wine only. And so based on that interpretation, BAM is looking forward to applying to the Liquor Authority for a beer and wine license for its cinemas. These cinemas have been at BAM. The structure itself has been around since the very early 20th century, late 19th century. It's been in use as cinemas since 1998. There's 4 movie theaters in the cinemas. And there'll be a little concession stand like there always is, except instead of buying the normal concessions that you get at movie theaters, you could also now buy beer or wine. The actual operation of the cinemas is not going to change from what it's been since 1998. It's just the addition of beer and wine. The premises is, as far as the ADA question is concerned, the premises is up to code, and they're in the early phases of a plan to further accessibility at the premises. And they've already been very deeply engaged in local hiring. They have a workforce program that works with them on local hiring. And I understand there's some other resources that were mentioned tonight, which I know Elizabeth has already taken note of. So we're happy to answer any questions.
Just confirming you've got no outdoor seating here, and it's going to be no residents appear to be immediately adjacent to this location, given where this place is located.
Correct to both of those questions.
Okay. Any questions from members of the committee? Any questions from members of the board or members of the public here tonight? Okay, hearing none. Does anyone wish to make a motion?
I offer motion, we approve.
Ms. Cobb makes a motion. We have a second?
Second, Emily Anadu.
Second, Ms. Anadu. Any discussion on the motion? No discussion. I vote in favor of this application. Ms. Cobb, how do you vote?
In favor.
In favor.
Mr. Andrews votes in favor. Ms. Anadu, how do you vote?
In favor.
Ms. Cumberbatch? How do you vote?
In favor.
Ms. Einhorn
Favor.
and Ms. McKnight.
In favor.
Excellent.
Thank you very much.
Thank you all very much.
Thank you, everyone.
Good
Have a
luck
good
with
evening.
your new service.
Thank you. And we look forward to welcoming you all.
All right. Have a nice evening. One more call for the applicant who was not present before. Did anybody suddenly appear from 162 Montague Ding Soup Dumpling? All right. Well, we will keep going. Up for renewal tonight, we have 111 Front, Almar, 159 Bridge Park Drive, Brooklyn Sale, 290 Livingston, Coon, 77 Sands Rooftop, Randolph Beer, 139 Flatbush, Applebee's, 55 Water, Dumbo House, 25 Lafayette, Tacombe, 5 Front, Los Colonistas, 101 Montague, Lantern, Pearl Plaza, Dumbo Station, 77B Hoyt, Little Sweet Cafe, and 151 Remsen, Curry Heights.
Mr. Chair?
Can you hold on for 1 second, Mr. Andrews? Ms. Mueller, are you aware of any concerns that have been expressed by members of the community? And I believe you're indicating no objections from members of the community for any of the renewals. Now, at this point, I want to solicit any comments from members of the board, members of the committee, or members of the public with respect to the renewals. Mr. Andrews, did you have something you wanted to say?
I didn't know because Applebee's is a franchise. So my question to you is, what are we voting on? Are they opening up a new restaurant on Flatbush? Because they're already
No,
inside the mall
this is
on Atlantic Avenue.
these are renewals. It's renewal of their existing location at 139 Flatbush. That place that's on the corner of Flatbush Avenue and I believe it is DeKalb.
But that's in the mall though, right?
I don't think it's in a mall, or actually maybe it is in a mall. I'm not.
Restoration Plaza.
Yeah, that's the mall, because in the mall it has Applebee's, it has Buffalo Wild Wings and Chuck E. Cheese. So yeah, I think that would be yes.
I think you're right. Now looking at the address, plugging it in online, that is in the mall. I'm sorry.
It's in the Atlantic Terminal Mall.
Correct. Yeah.
Gotcha. Okay.
All right. Aside from the location of the Applebee's, is there any other questions, comments, concerns? The whole point of this is if there's anyone who has a concern about one of these applications, because these are all operating right now, this is the time to let us know and we can talk about it and see if there's anything that can be done. All right. Does anybody want to make a motion with respect to the renewals?
I make a motion.
Do you want to approve them, Mr. Andrews?
I approve, sir.
Okay, a motion to approve from Mr. Andrews. Do we have a second for Mr. Andrews's motion?
Second.
All right, Ms. Cumberbatch was first. I'll give her the second. Any discussion further on the renewals? All right. If you oppose any of these renewals or would like to abstain from any of these renewals, please say so now. Otherwise, I will consider this a unanimous approval. All right, the renewals are unanimously approved. Chairperson's report. It's been an interesting month, as I'm sure it has been for everyone. And I just want to thank Ms. Mueller for a extraordinary effort over the past month as the only member of the board office who's been supporting us. And I think we've had a good meeting tonight and appreciate all the work that goes into that. I also want to extend my thanks to Mr. Singletary, who has approved and agreed that we shall be planning the health fair that we voted upon. And I'm looking forward to discussing that a little bit with folks in the other business section of the meeting. Other than that, I just hope that we're keeping an eye on the different presentations and the different kinds of district needs that we can keep formulating. It may not be the time, and we may not have the schedule we originally planned at the beginning of the year, but I do hope that we're going to pick that discussion up again soon. And we've got 2 more meetings left in the community board year. So the goal will be to try to make sure that we hit certain topics. Particularly, I want to see if we can do something with maternal health before the end of the year. But that's my chairperson's report. And I think from this point, we can go forward in the agenda to other committee business. I know I have some items, but I don't want to monopolize them. Does anyone want to raise an item for other committee business other than what I just spoke about?
Oh, sorry, Emily, please.
Go ahead, Lindsay, go ahead. Okay, I was going to say that depending on what's going on with, or just, I've lost the plot on where 11 Hoyt is, that the shelter that was being put up. But it would be interesting potentially to see what they're doing as far as jobs, and maybe that becomes an additional resource we offer to people that are coming before the board for liquor licenses, just as we're making suggestions, since we know obviously that they're close. So that was it.
That's a good thought, and we'll definitely have to see what comes of that. And I agree that like the topic of homelessness and the shelters is something that we're going to need to keep high on our agenda, because it's one of the fundamental parts of our committee. And we heard at the last executive that Mr. Singletary is planning to have the DHS take more of a lead in the next hearings that occur with the other shelters that are coming. So we'll be interested to see where that discussion goes as well too. But you're right. If we're able to kind of work out some kind of job related, if they have like a job center as part of that, then that would be wonderful to plug people in. Particularly like just tonight, we had places on Atlantic Avenue, Bond Street, right near in that area. Ms. Einhorn, did you have something else you wanted to raise too? I saw you were about to say something.
I did have a question if there was any way that the committee could support next steps for the health fair. And I also, I'm curious if anyone else is interested about what's been happening with the relocation of homeless right now. Because I do think it's a health issue and a social service issue. And I know we have a lot on our plate right now, but it's every time I read the news right now, it's just bothering my heart.
Well, here's a thought on that. I mean, we'll talk about the health fair in just a second, but we were going to write that letter last time, and we didn't get the action report written for it. And maybe there's a way to kind of take a topic away to draft something on and see what we can put together if there is a consensus about this issue, or because I think what you're speaking about is just concern about the relocation of like I guess the sweep that's been going on across the city to clear out all of these homeless encampments.
I think the way I would phrase it is, my concern is that resources are being directed towards removal and creation of beds for mental health holds versus investing in preventative measures and social services. So I think it's a misallocation of city resources, and it's not going to stop the problem. It's only going to remove it from public view.
Okay. I mean, I think that sounds like a reasonable topic for our committee to be engaged in. It's one of our functions. Are there others on the committee who are you don't need to express your full passion in 5 to 10 minute speech about the issue, but if you are there others who feel similarly to Emily or to Lindsay, and sorry, my mind is going, and may want to work on some kind of like an action report for this?
I would be happy to. I would love to, Lindsay, work with you on that. Because I think also it'd be good for us to have just, and this was a point I made when we were talking about composting, that it'd just be good for us to understand at the end of the day, we're not working with an unlimited amount of funds. And so it'd just be good for us to understand the magnitude and impact of doing certain things. Because, for example, like if I'm told that I only have $1 to spend, I would spend it on homelessness versus composting as an example. So yes, I just love the idea of us being informed and making sure that we're balancing our recommendations and being realistic.
Okay. Anyone else who feels like they're interested in working on something like this? And maybe this is something that you all can take away and I can help with as well too. And if we can try to maybe get some kind of a draft together before the next committee meeting, maybe we can all have something to look at that point and then decide if we want to vote on something.
Brandon,
Willing to help out too.
since John just joined, I'm wondering if it's come up at any of the public safety meetings in the neighborhood recently.
Sorry. First of all, somebody said they wanted to help. Who was that? I didn't hear because they weren't long enough on Zoom.
It's me. I was having a
Oh,
little
Ms.
coughing
McKnight,
attack.
thank you so much. That's great. I would love to have your engagement with that. Now, somebody just joined. Is that Mr. Harrison?
It is.
Hi, Mr. Harrison. Do you want to introduce
Hi.
yourself briefly?
Yeah, John Harrison, member of longstanding. So was that question from our fellow member directed at me?
I think there was a thought that maybe you were aware of what was going on in local public safety meetings.
Well, as a vice president of the ADAs, I am aware of what's going on in the meetings. This has not come up recently. We talk about it more at community board, and it actually seems to come up more in the general meetings.
Okay.
And so I was wondering, sort of, is the committee going to be a little more specific in what it's in view of your recommendation or your thoughts, Mr. Chair, that we come up with like an action plan or an action
Yes,
report?
that's pretty much what we're going for. Is
Right.
we're going to
Well,
come
I'm
back
just
with
won-
something in writing.
Right. I'm just wondering what's the goal here?
Well, I mean, I'm not going to speak for Ms. Einhorn or Ms.
Right.
Nadu, so I won't. Ms. Einhorn, it was your idea originally. What is your goal?
So I think that the resources that are being directed to law enforcement could be directed to social services. There's a lot of overtime that's going into it. There's increased presence in certain areas. And then there's the resources even that the state is devoting to support making holds for people who refuse to leave. And so those involuntary holds, there's actually, I think, probably going to be legal proceedings over that, but that's almost a separate issue at this point. And so what I'd like to see is investment in DHS street teams and making sure that local businesses are aware of escalation protocols outside of NYPD procedures, and an investment in social services that are preventing homelessness versus policing the homeless.
Okay, so the reason I asked Mr. Chair for the specific was, and I thank you for that, because those investments, I have to be careful here because I'm an officer of the department, but those investments that you seem to be seeking are there. What's different under this current administration from the last is this policing issue. I get it that in many ways, in many persons' points of view, that allocation of police resources towards street homelessness, I think that's sort of what you're referring to. At least I'm reading that into it. Is I'm not going to put words in your mouth, but I will say something I think is not disingenuous and not factually incorrect towards your viewpoint. Is maybe misallocated money or overzealous or something in those regards. It is the position of the administration and not necessarily the department that And it came up in the paper today that encampments be cleared and services be offered. And I'm saying this because we do discuss it sort of peripherally or as a topic, sort of, we talk about it from meeting to meeting in this committee. The other thing is this that I heard, I believe you said, was or perhaps it was from one of our other colleagues. I don't know if the right word is shifting, but it's taking money from where it's being spent now, somewhat with how it's being spent in dealing with street homelessness and others, right? And creating permanent housing. The permanent housing is there. The problem here is that the city is required to provide shelter. It's a requirement. And so from administration to administration for like 40 years, it's this balance of we have to provide shelter. We want to provide permanent housing. We don't want people, no matter where their mental state is or substance use, out on the street for lengths of time, purely street homeless. And different administrations have tackled this differently, but it's, I don't mean to sound negative, but this administration is not going to stop dealing with street homelessness the way it currently is in the near future, because there is a perception that there is some percentage of street homeless who will not accept services. And it's for that reason that they, these are generalizations, but it's generally the opinion, I think, of the administration that they will not, they will stay encamped, I guess is a way to say it. To use a word that seems to be in the jargon with the city and in the homeless advocacy community, that they in fact will stay encamped outside. And I saw it again in the paper today where the mayor said, you know, there's nothing wrong with being outside, living in the rough, as they say, but encampments are not allowed. So there's a disconnect, and that's the reason, Mr. Chair, why I asked what's the goal here, because I think that sometimes when we talk about homelessness, either in committee or as individuals on the board or as in general board meetings, we sort of talk about the general issue, and they're all good goals, but my other observation, which also hasn't
I can appreciate that, John. I just want to say, I've given you several minutes to talk about this. We can have a full discussion about this next month, and we're not going to have a vote on this tonight. What I'm hoping that Ms. Einhorn and Ms. Nadu and Ms. McKnight will do is take it away and put something together that we can talk about, having something actually written. And I really would like to move along in the evening to talk about our health fair, because that's something we have actually voted to do.
Okay, and I just want to say I thank you for allowing me this time, because it is an issue we talk about. We talk around the edges, but we don't really get to the matter. So I just wanted to set that in play, because there are people on the board whose issue are these encampments and how they're specific to board two. And from meeting to meeting, I keep trying to say that they're throughout the city. So, but thank you.
Okay, well, I appreciate that. And let's move on to talk about the health fair now.
Right.
So on the health fair, I think it would be really helpful, as much as it is to, when you're thinking about planning an event like this, to focus on some of the less, I guess, enticing topics and start talking about some of the nuts and bolts for how to actually put it together. And really, when you're doing this for any sort of project, the keys are first figuring out what date it's going to be, what venue it's going to be, and then a rough sketch as to what the event will look like. And I think Ms. Masso is here and could give us some additional details if we need. But I think from where we've left the discussions and generally how things have progressed, based on the fact that we're just now kind of starting to do this, the plan is roughly to have the event at either Fort Greene Park or at Commodore Barry Park, and to do it either on the last weekend of June 25th, I believe, on a Saturday from about 10 to 4, or on any of the last 3 weekends on the Saturday of not 4th of July weekend, but effectively one of those other Saturdays. And it would be really helpful if we could just sort of initially kind of come to a agreement about what would be a good date and what would be a good location. And then we can go from there to kind of talk about the different services. I think somebody was speaking. Was that you, Ms. Masso?
Yeah, no, I was just following up with you to say July.
Okay. So do you think, yeah, July also, absolutely.
So the dates was, the dates was June 25th, July 16th, and July 30th. The dates before we had to rethink because we're getting closer to that time period. And so the first thing, like Brandon said, we need to discuss a date and also a location. The 2 locations was suggested was Commodore Barry Park and Fort Greene Park. Me personally, I feel maybe Commodore Barry Park would be better because it's in between Fort Greene and Farragut housing development. And because it's in between, it'll be more likely to get more individuals from Farragut development out. Just because if you have it at Fort Greene, that means Farragut individuals may not come over. And as far as Commodore Barry Park, in the past, they had the Afro Puff concert, and they also had the African Street Festival. And I looked on the calendar. I had other people double check. Monique also looked for me also. And we didn't see anything listed for June or July as of yet.
Okay.
So there's nothing listed as of yet for June and July. So I guess we need to really, first of all, vote on a date, and then also vote on a location, and then we could put in a permit for the park.
Well, I think that's helpful. I really would want to just I don't know if we need to take another vote as a committee about each one of these different things as we're planning it, but I think if we can try to come to a consensus about what we want to do, that would probably be the best action to take. And I would open it up to members of the committee, really, when you're thinking about this event and what you hope to get out of it. And for,
Mr. Chair.
Wait, Mr. Andrews, I can absolutely take you in just a second, but I'll open the floor in just a second. But I would just want you to think, if you were one of the folks who's really planning to help with this, then also, we want to be respectful of your own personal schedules for the summertime too. And if there's a weekend that you can't do, these are weekends that seem like they don't have major conflicts from big fairs and stuff that are going on in the parks. I would really be interested in hearing your feedback as of now about that. So I think this is like thinking in terms of date and location. What do we think, Mr. Andrews, and then Ms. Cumberbatch?
It sounds good to me. Just let me know ahead of time, because on Saturdays I work and I don't get off until 8 a.m., 8:45 to be exact. So I could do it anywhere after maybe 2 p.m. or so. Also, do we know that, these permits cost money, number one. Number two, even if you don't get the permit, the board is the entity is out of a whole lot of money. I'm just letting you know that's what I was told.
Right. So, Mr. Andrews, I don't doubt that you have real concerns here. What I really want to try to work from first is just trying to figure out what would be a good date and what would be a good location. And this way we kind of focus our discussion in this area. And then as we progress into other areas, there are lots of other topics that we're going to need that we can talk about in terms of concerns and issues that might come up with this. Ms. Cumberbatch, did you want to say something?
Okay.
Yeah, so I will be helping Tracy. So I know the 30th would not be a good day for me. As Tracy mentioned in our earlier conversation, July 4th is usually there's a festival that weekend. So probably the 9th, the 16th, or the 23rd. As far as permits, I believe permits are $25 for events. And I would definitely be in favor of using Commodore Barry Park. because I think we'll hit more people in terms of having a better socioeconomic, just in terms of having different people from different socioeconomic backgrounds in attendance and those that would need it most if we used that particular location.
Great. Thank you very much for sharing that. I neglected to mention earlier that Mr. Singletary had also offered to me that Brooklyn Hospital will be happy to partner with us in this effort. And I think they have an effort going on at Fort Greene Park, but I'm sure that we could find a way to leverage it if we ultimately feel as a group that Commodore Barry Park is a better place to do it. And I'm rather ambivalent as to which location it shall be. So I'll leave it at that. And Ms. Anadu, what would you like to say?
I was going to say that I advise against Fort Greene Park if it's on a Saturday, just because of the farmers market. And I just don't think it creates like a welcoming environment for what we're trying to do here.
Okay, thanks. Any thoughts or concerns about the dates? Ms. Anadu?
I have to say,
sorry. No thoughts or concerns about the dates from Ms. Anadu. Ms. Einhorn?
I strongly recommend doing it while the community board is still in session, which means the June date. I just think it's more conducive to getting it done, and in the lead up to an event, I think there's a lot of communication that is necessary, and doing it when we're not in recess, when we're in recess, might make it difficult, especially for anyone outside of the committee if we want to pull them in.
Right, I can imagine that with folks outside the committee. But I do want to make one point that we're not going to be relying on the board office for this in really any respect. I did want to ask the board office, Ms. Muller, do you prefer if when we're inviting folks to this that we copy the board office, or is there any preference you have about how you'd like to be informed in the course of this process?
I have to defer to the executive committee's preferences on that. We would certainly promote it and do the same outreach as we would for any other community event. I believe that the office can issue invitations for collaboration to the full board on your behalf. Someone on the committee would just need to be the receiving party for responses.
Okay.
We should double check that at the next executive committee, Mr. Smith, but I think that's fine.
Okay, that's fine. I would just like, given that we're planning for the summertime, it would be great if we can figure it out before the end of the month. But maybe if we can talk offline about it and try to figure out the best process, I'm happy to work with you however you like. Anyone else want to make a comment about the date or the park? Mr. Harrison.
Thank you, Mr. Chair. Yeah, I would agree with our colleague who just chimed in on the date, that I think that it would be beneficial to have it when the board is in session. And it's not unlike me being, Mr. Chair, sort of the chief standing alone, but I get it that we might capture certain folks who might not come to Fort Greene Park if it were held in Commodore Barry. And I get that in with sort of one half of my head. I don't know whether it's the left or the right. But on the other hand, I think that the Fort Greene Park location is quite centrally located and sort of makes it available to all. I strongly recommend that whatever we do, we keep in mind that we're not trying to target this to any one population. It's supposed to be for the community. And I think there's a plus in having it in Fort Greene Park for the reason you mentioned, Mr. Chair, that Mr. Singletary said that the hospital was willing to work with us, or however you put it. There's a plus to that too. So I would think that the better location would be Fort Greene Park, and the better time would be when the board is in session. Now, when the board in session might be, there just might not be enough time to do it to then, but thanks very much.
Right, thank you, Mr. Harrison. So I want to go back to Ms. Cumberbatch really quick on the date. June 25th pose any issues on your end? I know that you mentioned the July dates were accessible to you and the July 4th was not, but I didn't hear any, I wasn't sure about June 25th.
Actually, it was July 30th because I'll be traveling the
okay.
next day. June 25th, I don't think would pose any issue, but I'll just check and verify.
Okay. So do we think we could all agree on June 25th as the date then for the event? I'm not necessarily going to take a vote, but if there's anyone who feels June 25th is a bad date for this would be a good time to raise your perspective. Yes, not that weekend, not Father's Day, not Juneteenth. We're not going to do it then. It looks like it's the weekend before some meeting. It's not 4th of July weekend either. No. All right. So let's say tentatively we're going to do this June 25th. And I feel like a few more folks on the committee who are interested in doing it at Commodore Berry Park than at Fort Greene Park. I don't know whether Mr. Singletary's hospital, Mr. Brooklyn Hospital, will be able to participate the same way at Commodore Berry Park, but I haven't heard that they won't, and I'd be more than happy to follow up on that issue with him.
Mm-hmm.
But I respect everybody's opinion on every issue. I just want to try to go with kind of the majority sentiment that we have here. Is there any really strong concern against doing this at Commodore Berry Park?
I'm not involved in the planning, and I respect the folks who have, done all the work. I do live in the community, and somehow Fort Greene seems like a better place. It's easy, accessible. And in addition to that, since the Brooklyn Hospital is doing something, it just makes better, it just seems like a better move to me. I go to the Juneteenth festival, and a number of things in the park, jazz, and it's very difficult parking, just like all of it. But I certainly think it would be much more easily accessible at Fort Greene. And you would reach all kinds of people there. There are people in the project, all kinds of all economic status. You have the projects across the street. People get out in the summertime. That's just my opinion.
Okay.
And
Ms. Cumberbatch, I saw you have your hand up.
Well, keep in mind, we do have interest from Cumberland Diagnostic also in terms of participating. I've already emailed them and they're just interested in, whatever date and would like to move forward with participating as well. So
I mean,
and there's also Mount Sinai Hospital, so we could also reach out to other hospitals in the community. No disrespect to Brooklyn Hospital. And
that's true. That's true. I want to see if anyone who hasn't spoken, and let's see. Ms. McKnight, did you have a view on this?
I did. It's just that I've been having this allergy issue, so I hope I don't cough
No,
through
it's
it.
okay.
And I've gone to Cumberland Park for other events. I was thinking about the comfort level there. It depends on where you have it, because there's been times when I was there and it's hot and I just wasn't comfortable all the time. And I'm in agreement with Ms. Cobbs and Mr. Harrison at Fort Greene Park. It seems more accessible, and getting over to the other park, it can be a bit of a trek, because you got to get across the BQE, Park Avenue, but I will still go. It hasn't stopped me from going to events there, but I do remember walking around saying, oh my gosh, it's so freaking hot.
I got you. And but maybe there's something we can do to try to make it a little bit more cool. Maybe there's some kind of service or something that we could do as a and I want to also kind of address the issue of accessibility, because it's sort of accessibility for who? For me, maybe it's not that accessible because I don't live next to Commodore Barry Park, but at least from what Ms. Massa was saying, there are a substantial number of people who live next to Commodore Barry Park, and it's always like this park that I feel like deserves more attention and support than some other parks that we have in our area, because the other parks in our area get so much support. Like you see the Brooklyn Bridge Park, forgot even the tiny Cadman Plaza Park right across the street from me. They have a conservancy and it's not like they don't have anybody at Commodore Barry Park, but it just seems like that's a place that really should have some more indulgence and support from the community. Ms. Einhorn, you had your hand up next.
Yeah, I mean, the first point I wanted to make was actually 100% agreeing with you that I think it's an underserved area. As far as to address some of I think there might be some ways to address it. So DEP does misting stations, and they can also provide water fountains. And maybe we can also talk to Brooklyn Navy Yard. Maybe they would even let their shuttle service stop at the health fair.
Well,
because yeah.
Sorry. No, I was going, sorry. Good point, Lindsay. I reached out to Ethan, and Ethan's supposed to be getting back to me to see if Brooklyn Navy Yard can be a part of the event and also can supply tables and chairs. And it'll be easier for Brooklyn Navy Yard to get the tables and chairs and support that we need right over to the park instead of going all the way to Fort Greene Park. So that was one of the things that, if they agree, but he didn't agree. Definitely he had to speak to his event planner.
Maybe you could ask them for some tents too, some pop-up tents, because they use them for their job fairs and some other activities. I think they have them.
Excellent. Ms. Anadu, your hand was up next.
Thank you. So two things. So one on Fort Greene Park, just that if it does end up happening there, then I would just say that we put it on the Myrtle side of the park. And while I understand obviously that people are saying this is to serve everyone, let's be real, the people on the DeKalb side have great insurance and are not suffering from the same issues. So I just want to be real about, we're not actually, like, it would not be a good outcome if people, like, anyway. The other thing is for Brooklyn Navy Yard, I'm seeing Lindsay Green tomorrow. So that for us is an easy conversation, and happy to, Lindsay, who just took over, or not took over, but became whatever she is there, that seemed, we talked about one of our last meetings. So that's an easy conversation. Lindsay is awesome, and I'm sure would love to help. So Latrell, I'm happy to work with you in terms of like what a request looks like to them, so we can make that happen.
Okay. And also we can follow up with Ethan too. I'm sorry, I don't know who Lindsay is.
No.
Lindsay Green is the new like head of the Navy Yard.
Okay.
Yeah.
Thank you, Ms. Anadu.
Thank you.
Ms. Cumberbatch.
So just thinking about like Fort Greene Park, yes, it is more accessible, but it's also a very busy park during the summer. And I certainly would recommend doing it on the Myrtle Avenue side for a number of reasons, mostly for what Emily mentioned. It's one of the only flat areas in the park, but it's also the barbecue area. So we would have to be circumspect about what area we chose to utilize. And if it's a very popular day that day, there's going to be music blaring and a lot of activity going on. So it might be a bit too much commotion for us to be able to have an event that I think would be successful. I mean, we would have access to folks because they're there, but I just don't know if that would be the best setting for the event. And I would like, Farragut is an area that is definitely overlooked. in terms of outreach. So this would be a great opportunity for us to be able to reach that community as well, if we use Commodore Barry.
Okay. I think we've all made a number of points about this issue, and I think it really makes sense to kind of come to a determination about which way we want to go. So I guess it would help if we could just try to kind of state what each of our preference is, having heard all of this, and we can kind of work. I'm happy to go with the majority of folks on the committee and their views as to which way we want to go. But I would encourage people to think about the folks who've really agreed to step up and commit to this, particularly Ms. Masso, Ms. Cumberbatch, Ms. Nadu, and Ms. Einhorn and Ms. McKnight, who've all kind of volunteered to take on a role of being not just a committee member to sit back and watch this, but to help actually do the planning, do the asking, do the participation. Anybody feel like that's not the right approach to kind of get the majority of the committee and go with that? Because it seems like we have some folks who prefer Fort Greene Park, some folks who prefer Commodore Barry Park.
Mr. Chair,
Mr. Andrews.
if you need a PA, you can always call on me, because you're gonna need one out there. You're talking to people, you're gonna need them to come down to the table. With all that music going on, you're gonna need some type of PA to talk to the people. I don't know how you think it's gonna work without that.
No, I know we've thought about music, but that was, believe it or not, we're not going to figure out music tonight.
No, I'm saying
I appreciate that. No, I would love that. I would love to talk to you about that. I think that would be great.
What are you guys trying to figure out? What table?
We're trying to figure out Fort Greene Park or Commodore Barry Park. That's what we're trying to figure out.
Don't matter. Let me know when y'all figure out. Let me know. I'm here, but
okay.
I'm not too picky.
Okay, I just, out of respect for the committee who's done the work, they've done a lot of work and on it, whatever their suggestion is, I'm there to help. So Commodore Barry Park, if that's it, that is. They've done the research, and they've done the work.
I agree too.
Yeah.
They've done the work. It
They've
seems
done
like
the
a
work,
lot of
they've
thought
done the
has gone
research.
into it.
Mr. Chair, I think you have your answer.
Okay. So I think our consensus is that we're gonna go with Commodore Barry Park, and we're gonna be happy about it on June 25th, from about 10 to 4 p.m. From 10 a.m. to 4 p.m. And if we can definitely change some other things in that regard, but that was about what I wanted to help figure out tonight. In between now and the next meeting, we'll try to, I'll connect with the board office and try to figure out how they want to be engaged in the process, and really let them direct that. And we'll also hopefully start more formal reaching out to people to see what we can do in terms of services. And just to briefly talk about it before we get going for the evening, the thought was to provide some services at this fair, different kinds of screening, whether it be breast cancer screening, whether it be COVID testing, I'm sure there's some things that I'm forgetting here, Latrell, but a lot of it would be this. Then there would also be a panel discussion that we hope to have at this fair. I think we've spoken about it a bit before, and it might be good. Latrell, feel free to fill in the blanks a little bit more, just to think about maybe a general topic that we might want to have for the panel discussion at the fair.
Yeah, well, there was well, it could be from breast cancer to diabetes to Alzheimer's to dealing with elderly parent. But one of the topics that stood out for me from the beginning when I first started coming to the meetings on Zoom with you guys was, I always mess up his name. So God, I have a speech problem. So
Alejandro.
Alejandro's favorite topic and is mortality. Am I saying it correctly?
Yes.
So we could cover the topics that we cover in the meeting, so they can see what we talk about in each meeting. So we could take what the meat of what we do in the meetings and bring it to the community. So that was one of the topics, but that would be something that we would have to vote on. And that could be the panel topic. And also we can have the tables with breast. It's funny, when I spoke to the lady today, there's a van that goes around and do breast exam and mammogram. And it's funny because the dates that me and Brandon spoke about was all the dates that they was booked, but they literally go around to location. It's a van and they give free breast exams to the community. So I thought that would be great for our community. But unfortunately, the dates we gave was all the dates that was booked, taken already.
Yeah, so maybe we don't do them, but maybe there's somebody else who could provide some kind of a
Yeah.
similar service, and we could talk more about that.
And also I wanted to say WBIA 99.5, they agreed to be one of our sponsors, and they were educational at the Crossroads. This host said that he'll definitely promote our event, and they want to be a part of the event.
Sure. Yeah, that's great. BAI is great, a great venue.
Does anybody have any thoughts about the panel topic really quick? I do want to kind of wrap up our discussion soon, but I want to get that thought out too. If people think that we should be providing a panel on one thing or another, we spoke a bit about maternal mortality. I feel like maybe maternal health more generally might allow for discussion of some other things beyond just mortality, like prenatal care and importance of that. But I'd love to hear other people's thoughts. Anyone else?
Going once, going twice.
Well, that was definitely one topic I was interested in having someone present on, just Googling. And I see that Health and Hospitals actually has a maternal mortality reduction program. So you could certainly be a resource.
Okay.
I was thinking of something around the area of wellness too, because I'm thinking of the population we're speaking to, and we know colon cancer is higher in the African-American community. So I would think it would be important to perhaps speak on issues that are really affecting our population, that population. And speaking of wellness, of how you eat or de-stresses or well-being, of ways to prevent those diseases and cancer.
That's an interesting thought. I think you definitely want to have something that's going to be beneficial to the people who are coming there and give them something to take away. And I think that that's really like getting at the kind of basic things that we would want people to know and do. And maybe we can have people speak about that. But that from your suggestion, are you thinking maybe we go broader than just women's health and also kind of take the community's health as a whole in this regard? Or because,
well, if you're going to do panel discussions, and I was seeing what Taya mentioned here, topics should be driven by known district needs. And we're stating that we want to ensure that we target the population that's in that area. And I know most of the population in that area, if we're looking at the public housing, there's a significant number of African Americans who live there, and colon cancer is higher. Maternal mortality is 3 times higher with Black women. So let's touch upon it and not just have it focus on women. Let's bring in the whole population. And then if you want to even get into mental health, what's going on with our youth, that's impacting everyone. I think there's a way you can touch upon those various things and pull it together. That's where we would speak to the professionals who would speak on the panel, who can tell us how to go about doing it.
okay, so maybe like health and wellness from a higher level, talking about each of those issues. And
yeah, importance of screening, but also sharing with people information about, eating certain meats are carcinogenic and it increases your chances of getting colon cancer.
Yeah, that I got a lot of what you said there, Nicole. My internet connection kind of cut out in between, and I'm sorry about that. But I'm guessing, I'm taking it that we're going to take it maybe at a higher level about health and wellness topics and hit on some broader strokes than maybe just focusing in on, but still keeping it to things that are known district needs, so that we can check that box as well too. Ms. Einhorn?
I kind of like the idea of doing a panel in the morning and a panel in the afternoon. And to Ms. McKnight's point, I think maybe something on preventative medicine might be, or just prevention, and might be a good topic. I think what we're seeing right now, not just in our community, but in every community, is that people didn't keep up with general appointments during COVID out of fear, and out of a myriad of issues. And so we're seeing a lot of really preventable illnesses that are going to be rising over the next months, years, and some, especially, cancer and things of that nature. We're going to see death rates rise this year in the next 5 years, is what I've been reading.
Okay, so that would be doing 2 panels. And I think that would work. It's just, it takes an effort to put these things together. So I would suggest that we try to maybe conceptualize one panel, and then once we've got that down and we know exactly how it's going to be composed, then we kind of plan out the second one. Granted, we're going to have 2 months to do this, so, or 2.5 months to do this, so we should probably figure that out soon. Anybody else have a thought about whether we should do 1 or 2 panels?
Mental health is definitely an issue that it's a lot of people. I did some Zooming programs on Zoom, and people are really concerned, especially the elder adults, about the mental health issues when they go out. They're really afraid. So I think mental health is something that the community should be educated on. And we're open to it at this point.
Okay. Any other thoughts on the panel's discussion? Well, here's what I would suggest. I would suggest that we start planning to have a kind of higher level panel on health and wellness that hits on some of the points that Ms. McKnight was discussing, and at least provides kind of a practical advice, steps, and guidance from health professionals on how to deal with common issues of district needs, whether it be colon cancer or something else specifically. We can kind of go by what we have available in terms of speakers, but certainly that's a thought. And I like to weave maternal health in there somewhere, and maybe that could still be part of the conversation. But it'll give us some flexibility. And then if we can kind of conceptualize something and make significant progress on this, then maybe next month we can start talking about, well, do we want to have a second panel, and then see if there's a way to do a second panel in addition to that. I just feel like it's a big step for us to be doing this. I want to not get too ambitious about what we're doing, and try to make sure that we get everything right by focusing on, like, well, right now, if we try to plan one panel, we'll see what we can do for this, and we get a good lineup of speakers, then that'll be good, and we have we have some kind of a framework for the event, and then maybe we kind of take it from there and decide whether we want to do another panel. How does that sound to everybody? And I'm conscious we're almost at the end of our evening, so final comments would be more than welcome. But if anybody has any thoughts to the contrary or strong preferences, otherwise, this would be good to know.
I agree.
Brenda, I think
Okay.
that sounds great. I just do want to flag that for a lot of the city resources, in order to make applications for them, the first thing you need is a permit for the park. And so I feel like we just need to prioritize that because otherwise we might be timed out on some of the other resources we're looking for.
Right, I agree with you, but I think like, do we want to get a permit for this? I don't think we need to like decide that. I think we all agree probably that we need to get a permit for this, and hopefully we'll try to prioritize that in the next month too, but I appreciate you flagging it. Yes, I agree. We should prioritize it. Any other comments on the health fair, and we can move on to our next agenda topic?
I just want to thank everybody for being supportive and willing to, pitch in one way or another.
You are most welcome, Luchelle, and thank you for coming up with this idea and being willing to work so hard to help promote it. We greatly appreciate it. Mr. Harrison apologizes, his device ran out of battery, so he had to drop. We're at the point of our meeting, which is community forum. Anyone from the community or anyone who's not a board member want to make a statement or make a comment, this is now your time. All right, I didn't hear from anybody. Does anyone want to make a motion to adjourn tonight?
I offer a motion to adjourn.
Ms. Cobb makes the motion. Do we have a second?
Everybody wants.
Everybody wants to stay?
I'll second.
Ms. Cumberbatch seconds. Okay, anyone oppose this or abstain? No, unanimous. Everybody approves that we should adjourn. Have a nice evening, everybody.
Yeah, thank you.
Good night.
Good night, everyone.